Breast cancer is the leading cause of cancer death in women in Trinidad and Tobago. As one doctor puts it is a lot more common than people think. He says there is a need for local data that can pinpoint how this type of cancer affects women in this country.
The worrying thing in Tobago is that it occurs at a much younger age than described in the Western literature. So that it's not uncommon for us to see patients with breast cancer in their 30s and 40s.
Dr. Bell says he has had at least 3 patients who were diagnosed in their 20s. In light of this, he thinks women are still being diagnosed with breast cancer too late.
There is not a national screening program. And when I say that, I may probably be taken into task. Whereas we do have screening, I don't think it is a national program.
And while Tobago does have the Pink Room initiative, it's only under a year old. So while it does offer a one-stop screening and treatment service for female cancers, it is not yet widely known. And as for the presentation of cancer in younger women in Tobago, Dr. Bell says in the absence of data, he has his suspicions.
I think it definitely has something to do with the diet.
His colleague, Dr. Asante LeBlanc, agrees, but she cautions women to take a more holistic view of their health.
People think eating plants alone is good. They forget to look at the quality of the plant base. Are you using excessive soy? Are you using a substitute that should not be substituted?
She says women need to be aware of their family history and they need to listen to their bodies.
So I think it's about slowly educating, slowly accepting and empowering and understanding how we ourselves can prevent and heal ourselves through our food, our thinking, our stress coping, our sleeping.
Rather than rushing to become vegan, which isn't necessarily bad, in fact, Dr. LeBlanc says she has noticed that people seem to be eating more local, less processed foods during the pandemic, and she hopes this continues. But she also wants women to stop smoking, to avoid drinking excessively, and to take steps to reduce their stress. Both doctors are asking women to do their monthly breast self-exam 5 days after their period, and once a year, go to your doctor for a clinical screening, and make mammograms a part of your annual checks after the age of 40. Soini Gray, CNC3 News.